Cancer Guidance by Type, Part 43. Dr. Dilip Gadgil, Pune. Malignant melanoma. This type of cancer develops from the pigment-producing cells known as melanocyte. Generally, a biopsy is done to diagnose whether it is cancerous. If it is, the tumor is removed. However, in this case, it could form in other places and spread across the entire body. I had a 60-year-old patient who was diagnosed with malignant melanoma. The first few times, the cancerous knots were removed. But then it was found that over 300 knots had formed in his body. One of those knots was as big as a coconut and was located near the anus. It was bleeding and he was taking analgesics before he came to me. My medicines were quite effective. We managed to come down to 1 painkiller from 6 painkillers. We treated the knot near his anus using some Ayurvedic techniques. He lived on for 6 months after that, which no one had expected. This was an advanced case. Generally, malignant melanoma patients are found in lesser advanced stages. Their knot is removed and chemotherapy is given. However, it is essential that we don't treat cancer like something that happens in a specific body part. At the moment, treatment is given based on where the knot is. When cancer treatment began first, radical surgeries were done. In breast cancer, radical mastectomy was done. However, people soon realized that removing the body part wasn't an effective approach. Today, this approach has transformed into what we call modified radical mastectomy. They use chemotherapy to reduce the knot size before removing the tumor surgically. But when we only remove the knot, there are chances of the cancer relapsing. It is important to remember that this is a bigger problem. It might show up in only 1 or 2 places in the body, but the problem runs deeper than that. And if this is the case, treatment should happen accordingly. Modern medicine only focuses on cancer cell destruction. But nobody bothers to think about how to ensure that cancer doesn't happen in the first place. Understanding the causes and avoiding them is very important. My endeavor is to raise awareness in this regard.